15 minutes left in our house call segment to get your questions answered about treatment for lung cancer and diseases. And Dr. Gamliel is back with us again. Talk to us about some of the trends in treatment for lung cancer. I know there have to be advances.
What we're seeing now is that lung cancer screening is detecting lung cancers at an earlier stage than ever, and the trend now in surgical treatment for lung cancer is to really do smaller operations, not only minimal access using tiny little incisions, but trying to conserve as much lung as possible. And what we're seeing is that for very specific scenarios where people have small cancers that are out in the periphery of the lung, we can conserve more lung than we used to and still get good outcomes and cure rates.
So are the minimally invasive surgeries as effective?
They are, actually. When I do a minimally invasive operation, I have an unbelievable view of what I'm doing. It's kind of like having my head inside the patient because I'm seeing everything up close and magnified. The outcomes research that's been done on minimally invasive surgery actually shows that the outcomes are as good or better.
Is it important to see a thoracic surgeon right away?
So lung cancer, like many other cancers, is going to be most curable at its earliest stages, and I think that time is not on your side if you have lung cancer. You want to make sure that somebody who knows what they're doing, who's experienced and who has the skill set that you need is on the case, is evaluating what you need, and is getting you what you need in a timely manner, because the sooner you take care of it, the more likelihood that you're going to be able to move on with your life and never look back.
So obviously the greatest risk factor is smoking, but you were sharing something interesting with if I quit smoking tomorrow, who are you going to see as a possible patient who has lung cancer? Is it the person who quit right away or maybe down the road?
So the bad news is that exposure to cancer-causing substances has long-lasting effects, and it may take 20 years to develop a lung cancer after you've been exposed to cancer-causing substances. Lung cancer is very common among former smokers, and that's why former smokers are not out of the woods, need to get themselves checked out. The good news is that after many, many years, your lung cancer risk does begin to decline.
All right, Dr. Gamliel, thank you so much for answering our questions. Our experts next door, thanks for taking our calls. The number to get your questions answered, got about 10 minutes, 410-671-0702. Appreciate it. We're going to send it over to Patrick now for a look at the weather.